Up next is Dr. Nadiv Shapira. He's going to be talking about lymphatic preservation during lipedema reduction surgery. He's in private practice in Wilmington, Delaware.
Good afternoon, Nadiv Shapira from Wilmington, Delaware, a lipedema provider. The lipedema reduction surgery aimed to remove the abnormal painful fat. We are going to start with that, remove that, but with one caveat that I learned in my first day of training in surgery: do no harm. We have to preserve the lymphatics. What fat to remove and how to remove it? These are the two questions we have to address. We made two observations. When you pinch the full thickness fat, it's much more tender compared when you pinch just the superficial fat. Second observation, the superficial fat, much darker, it means less echogenicity than the deep fat. And compared to obese non-lipedema, they're much similar. Same you see below the knee, lipedema fat, low echogenicity, and compared to the obesity. So, and you can measure, assess the echogenicity and give it some quantitation. So conclusion is the subcutaneous adipose tissue is not homogeneous. And I feel that the deep tissue is, the DAT, is lipidematous, not the superficial. And therefore, only the deep fat should be removed and keep the superficial fat intact. And why? Because if you look at the schematic description of the lymphatic vessel, those are just underneath the skin, where the deep fat, but the superficial fat, they're very, very delicate, sometimes 1 cell thick. Where they go deeper and deeper, they're much more sturdy. So that's a good position of the cannula, not in the superficial fat. Same here. That's getting worse, and that's really bad. Same, next question, how we remove the fat? We can use mechanical energy like PAL, we can use thermal energy, we can use water jet. When we make the decision, we have to remember that the lymphatic in lipedema is abnormal. There are multiple microaneurysms in the lymphatic vessels. The lymphatic vessels are dilated in lipedema compared to non-lipedema. And the flow of the lymphatics in lipedema is much slower. And that has consequences. As Tom Wright, my friend who sits here, described 3 cases where injury to the lymphatics caused some skin changes. That's okay, that's not so bad, but it can be much worse, can be disastrous, as Dr. Emes showed in Potsdam last year, that too aggressive and too superficial can cause this kind of disastrous changes. And that happens. And that's another case like that from the US. Sorry for the graphic, but that's the reality. If you're too aggressive, too superficial, use heat energy, that's what will happen. And that's after half a year of healing. She cannot work any longer as a nurse because she cannot stand. Now, I did a small experiment. I want to see how it worked. So if you see in the upper corner, there's a small laser beam. Then I put it into an egg, and you see the coagulation start to around that. And that's only at 34 centigrade. Heat it a little bit longer, much more, etc., etc. So can you imagine, anticipate what it will do, the tiny lymphatic capillaries underneath the skin. Therefore, I do not use heat at all. I use, let's see, I use the water jet. Hold on. How can I go? Can you make it, it's a video? So it's gentle, it's room temperature, and just the water make the dissection, period. And Dr. Stutz, in 2012, I believe, he's my mentor, who introduced me to the lipedema. He showed how safe is this method. He took aspirate from 30 patients and stained the aspirate specifically for endothelial cell, and only in 2 out of the 30 he found a very few lymphatic cells. That's the way all the other looked. So that's why I use it. They suction only the deep fat. No, thank you. Only the deep fat, and that's the technique basically. I use it for infiltration and for the irrigation, the water jet, and I irrigate only the deep fat. Let's hope that will work, because that just should show you, so you can see. I mean, sometimes it's difficult to introduce the cannula, but then to remove it, you can just go very slowly, like a vacuum cleaner. Go slowly, let the water do the work. Just one, like when you, how you will use a vacuum cleaner. If you're going fast, you'll not catch anything. You have to go slow, and that's the way it works.
Directly down.
Something point of view.
You see?
Oh, thank you. But you see, when you remove it, when you remove the fat, go slowly. The water goes all the time. But you don't have to move like crazy in and out, and less damage, less trauma. So the outcome in this group of patients all improved or recovered or fully resolved the pain, the tenderness, the swelling, and what's more important is the non-experienced increase in the swelling. So I conclude that removing only the superficial, only the deep fat, leave the superficial fat intact, and apply a gentle technique like the water jet, I think we can call it lymph-sparing liposuction. Thank you.
All right. Thank you, Dr. Shapira. Cheyenne texted me a question. Dr. Shapira? Cheyenne texted me a question from the audience. Is WOW better than PAL for lipedema surgery?
Good question, but first, Cheyenne, I want you to compliment me for being on time. I want to hear that.
She's pleasantly shocked.
I did. I was giving you props over here. Thank you.
You're invited back next year.
I want a sticker. Okay, it's a very good question. I don't have the answer. I don't have the answer because I think that should be studied. I'm trying to design a study now to compare the aspirate from PAL compared to water jet, stain them again with molecular marker to see which one is safer. Intuitively, well, Dr. Stutz showed that the water jet works well and does not damage the lymphatics. So that's what I'm using. I like to do this study. It might be okay to use PAL. I don't know. But intuitively, I think the motion like that so far, and the PAL, it's going up to 4,000 per minute. How can it compare? You just go like that, like vacuum cleaner, like you clean the house. You go slowly, and everything comes in. So I don't have a good answer then. Sorry.
Yep, thank you. I appreciate that.